Hey babe, welcome back to the day in life of an OTA student. I am currently getting ready for my second day of my Fieldwork level 2 rotation. And I guess you guys wanted some longer vlogs, so I'm gonna give that to you now. I'm not gonna be able to, show the patients or anything like that, but I'm gonna try my best to get as much footage as I can today. Oh, and I forgot to explain to you guys, in case you guys do not know. So make sure you guys follow me on TikTok because they pretty much get, you know, my tea first when it first drop. But I'm going to be consistent on YouTube now. So you guys will have the tea too. So Fieldwork Level 2 is a period of 4 months. And 2 months I will be doing my first rotation. The last 2 months is the second rotation. So right now my current um, rotation is at the hospital, and you guys will see where I head to next in my last 2 months. So just wanted to make that clear. And yeah, and then after that I graduate and I take my test for my state boards so I can be licensed. I'm official out here. Okay, so enough rambling. Let's get ready. Now it is currently 4:47 a.m. in the morning. I'm about to, finish getting ready, freshen up, dress, and I'll insert those clips, of course. And then at 5:20, around 5:20, 5:30, I like to leave. The hospital isn't too far from my house, but I just like to get there early, just to, you know, be the top tier student that I am. So I'm going to be doing my face routine right quick. And yeah, your dress, y'all see, y'all see. But if you guys like this video, make sure to like, comment, subscribe, and comment any questions you guys may have throughout the program. You know, for those who are inspired to go in or current students, just drop your comments and show your girl some love. And yeah, but my first day was pretty good, guys. Like, I got a good flow on how things are supposed to be done within the hospital setting, and it isn't as intimidating. Like, of course, it's only my second day, and I'm pretty sure I'm going to see a lot more stuff, but for the most part, it's pretty not that hectic. It's pretty okay. So, and my CI is wonderful. Like it really helps to have a good CI. Like she's giving me a lot of information that I can use, and she's just the best. So we're gonna get finished ready, and I will see you guys in the next clip. So a little about me while we're just getting ready. Um, you know, I'm from Florida. For those who don't know. So I started the program last year, August. I had to take one more prerequisite class in order to get into the program, which was algebra. Um, no, actually, I'm sorry. I had to take two prereq classes before I started the program, which was algebra and anatomy. So after I did those classes, I had to basically, just wait until January to start my official occupational therapy assistant class on campus. And my experience was just honestly, the good, the bad. It was a phenomenal experience. The part I missed the most about going to campus, because I don't go to campus anymore. I don't go well, I don't go full time to campus anymore. It will be only one day out the week I go, and that's only to take my test. Um, I'm gonna miss my classmates. Like it's like so weird not seeing them every day anymore because once you get into your program, hopefully you develop a good relationship with your cohort. And when I tell you, like, they're like family to me, like, it's crazy. But we don't see each other anymore. And it's just like, I'm thinking about it, like, oh my gosh. But, we just leveling up and doing what we have to do. But, yes, y'all, I'm just trying to basically rush, get ready because I like to be early, you know. And am I a morning person? No, I'm not. But I gotta be. I gotta be now. So yeah. So when you guys do your Fieldwork level 1, for those who are inspired to be in the program or currently in the program and are going into Fieldwork level 1, take all that you can from it. And that portion of the program is that I'm sorry, that Fieldwork level 1 is all about observing. So you're just there to observe, you need to start like mapping out, okay, I don't really like this setting, but I enjoy this setting, or it's something about the setting that I like and I want to explore even more, or, this setting is just a no. So just start having that in your head. So by Fieldwork level 2, hopefully your professors give you the option. Your fieldwork coordinator gives you the option of, okay, what do you prefer? Now, they might not give you, they might only have limited options. I don't know how it works for every school. So you might just get what you get and you just got to roll with the punches. But if they give you the option, you're ready. And you can say, oh, I want to work in a PEDS setting. Oh, no, I want to work in a skilled nursing facility. Or no, I want to work in a hospital. So you have that experience under your belt because it's good to work in a setting that you can envision yourself doing. But yeah, I gotta hurry up and go. So I just wanted to give that little, you know, get that little talk with you guys, get that talk going with you guys. So I'm about to pack up my bag, my lunch bag, my book bag, and we're going to head out because we gotta go. Okay, so as soon as I arrive, I head straight up to the OT office where I will be waiting for my CI so we can go over the daily schedule we have for today. Today we will be seeing a total of 5 patients and I will be observing 2 evaluations. Just so you know, CODAs cannot do evaluations, only the OT can. However, we can assist when need be. The diagnoses I've seen today were dealing with stroke patients, CVA patients, and hip fracture patients. Each treatment session ran an hour long and we worked on ADLs. And this is a beautiful video of me going down the elevator, struggling to stand and keep my eyes open. Oh my gosh, you guys, I am so exhausted. Like, I just cannot, I have to catch my breath, but today was very successful. I definitely learned a lot today with pretty much everything, like as far as when transferring patients, all the safety precautions, when you have patients that are dealing with, hip fractures, they're in a lot of pain. So you want to make sure that you're transferring them up in sitting position in the bed, making sure that they're at the edge of the bed, making sure that they're transferring safe onto a rolling walker or a standard, and then you have to make sure the pivot is correct, make sure the wheelchair or the rolling walker is literally face to face with the wheelchair, having the patients, sit correctly, going to the bathroom correctly, sitting down correctly, just keeping everything safe. Safety. Like, that's what I took from today. Some cool things I saw today were I actually did 2 evaluations. So she had 2 evaluations that she had to do today, and it was cool to see. It was pretty basic. I mean, basically when it comes to evals, mind you, OTs can only do evals. CODAs, we cannot do evals. We can help assist, but we cannot make evaluations. So she got me, I got to see it. I got to see the 2 evaluations, and it was nice to see. It was pretty standard though, like just making sure that the patient can sit up, can dress themselves, can get in and outside of a car. Actually, the last session I just did was watching the patient try to get in and out of a what's it called? Simulator car that we have in the lab. So it has, the steering wheel, the seats, the door, and they basically had to get in and out safely. And my CI gave them helpful tips on how to do so. And it was cool to see. That was a good session. Anything else I saw today that was... Oh, I saw an edema wrap today. So one of the patients, my CI noticed that they were having some sort of swelling in their leg. So she just wanted to make sure that, just making sure it is wrapped and secured. And another thing I did today was that I did my first blood pressure test on a patient. So, hey, I did my first ever blood pressure test on a patient. And I definitely realized how you need to know where their level's at, especially if you have a patient that's kind of on the low side. So making sure that the patient is always, breathing correctly, is not, basically you don't want your patient to pass out on you. Like, you don't want that. So if you feel like they're showing signs, they look like they need to sit down, like they look like they're about to pass out, do that blood pressure test. I don't care how many times you got to do it. My CI made me do it, I think she made me do it 3 times, throughout the session. So when he was sitting up, we had to take it. When he was laying down, we had to take it. When he was sitting on the edge of the bed, we had to take it. When he was about to go to the bathroom sink, we had to take it. So she wasn't playing about that. So that's definitely noted. Making sure you keep tabs on that, because you don't want to risk anything. Okay, you need to make sure that all your ends are covered, because they're gonna be looking at you like, did you check this? Did you not check this? Like, what's going on? So that honestly, y'all, I'm the day was pretty good. It was just I just felt like this sessions were dragging a bit. But things we worked on today was basic ADLs. When you're working in a hospital setting, it's gonna be mostly ADLs, like getting them ready to start their day, like a daily routine. So whether that be freshening up their face, shaving, brushing their teeth, showering, dressing, upper and lower body, and bed mobility, really, it's pretty basic, because you're just prepping the patient to be discharged home, because this is the things they need. Now, we do some IDLs, which can be meal prep, or organizing things like that we try to do. But mostly it's gonna be ADLs, making sure the patient is checked off those boxes so they can successfully be functioning at home to the best that they can. And I'm trying to think what else. Honestly, y'all, I'm tired, I'm hungry, and I'm ready to go. But it was a good day. I want to say thank you guys so much for watching, following me along this journey. I promise I will do a longer video. So there you guys have it. I hope you guys enjoyed this vlog. I try to get as much footage as I possibly can. You guys know I cannot, show any footage inside of the patient's room, but I try to, do my thing, I'm just trying to do my thing, try to get my clips while I can. So, am I missing anything? I don't know. I guess leave comments. See, I'm tired. I'm tired. If you have any questions, leave them down below. Anything that you felt like I should cover, or just any question in general about the field, let me know. I will be for sure to answer it. Once again, this is my Fieldwork Level 2 rotation. And yeah, we are in the hospital inpatient unit. And yeah, I think I'm tired. All right, y'all. So if you guys like this video, make sure to give me a like. Subscribe to the channel. Thank you guys so much for subscribing. And I will see you guys tomorrow. If you enjoyed today's video, make sure to give me a big follow. And I will see you guys tomorrow. Bye.